Today we are going to cover about mental health. Mental health and mental illness are difficult to define precisely. People who can carry out their roles in society and whose behavior is appropriate and adaptive are viewed as healthy. Conversely, those who fail to fulfill roles and carry out responsibilities or whose behavior is inappropriate are viewed as ill. The culture of any society strongly influences its values and beliefs, and this in turn affects how that society defines health and illness. What one society may view as acceptable and appropriate, another society may see as maladaptive and inappropriate. A number of theorists have attempted to define the concept of mental health. Many of these concepts deal with various aspects of individual functioning. No single universal definitions of mental health exist. Karl Menninger defines mental health as an adjustment of human beings to the world and to each other with the maximum of effectiveness and happiness. The American Psychiatric Association defines mental health as simultaneous success at working, loving, and creating with the capacity for mature and flexible resolution of conflicts between instincts, conscience, important other people, and reality. That means the people should have the ability to cope with the stresses of daily living, freedom from anxieties, and generally a positive outlook towards life, a change of circumstances or alterations. Black and Anderson defines mental health as a state of being that is relative rather than absolute. The successful performance of mental functions shown by productive activities, fulfilling relationships with other people, and the ability to adapt to change and to cope with adversity. Robinson defined mental health as a dynamic state in which thought, feeling, and behavior that is age appropriate and congruent with the local and cultural norms is demonstrated. Thus, mental health is viewed as a successful adaptation to stresses from the internal or external environment, evidenced by thoughts, feelings, and behaviors that are age-appropriate and congruent with local and cultural norms. The World Health Organization defines health as a state of complete physical, mental, and social well-being, not merely the absence of a disease or infirmity. This definition emphasizes health as a positive state of well-being. People in a state of emotional, physical, and social well-being fulfills life responsibilities, functions effectively in daily life, and are satisfied with their interpersonal relationships and themselves. Generally, a person's behavior can provide clues to his or her mental health because each person can have a different view or interpretation of behavior depending on his or her values and beliefs. The determination of mental health may be difficult. In most cases, mental health is a state of emotional, psychological, and social wellness evidenced by satisfying interpersonal relationships, effective behavior and coping, positive self-concept, and emotional stability. Mental health has many components and a wide variety of factors influence it. These factors interact. Thus, a person's mental health is a dynamic or ever-changing state. Factors influencing a person's mental health can be categorized as individual, interpersonal, and social or cultural. How individual or personal factors are influenced. Individual or personal factors include a person's biological makeup, autonomy and independence, self-esteem, capacity for growth, vitality, ability to find meaning in life, emotional resilience or hardness, sense of belongings, reality orientation and coping or stress management abilities. These factors can change their mental health. Interpersonal or relationship factors include effective communication, ability to help others, intimacy, and a balance of separateness and connectedness can influence the mental health. Social or cultural or environmental factors include a sense of community, access to adequate resources, intolerance of violence, support of diversity among people, mastery of the environment, and a positive yet realistic views of one's world determines the mental health. Now we will see the components of mental health. They are autonomy and independence. The person can look within for guiding values and rules by which to live. He or she considers the opinions and wishes for others but does not allow them to dictate decisions and behavior. The person who is autonomous and independent can work interdependently or cooperatively with others without losing his or her autonomy. The next component is maximization of one's potential. The person is oriented toward growth and self-actualization. He or she is not content with the state in which and continually strive to grow as a person. Next one is tolerance of life's uncertainties. The person can face the challenges of day-to-day living with hope and a positive outlook despite not knowing what lies ahead. Next is self-esteem. The person has a realistic awareness of his or her abilities and limitations. Next one is mastery of environment. The person can deal with the influence the environment in a capable, competent, and creative manner. Next one is reality orientation. The person can distinguish the real world from a dream, fact from fantasy, and act accordingly. Next is stress management. The person can tolerate life stresses. The person will be able to handle anxiety or grief appropriately and experience failure without devastation. He or she uses support from family and friends to cope with the crisis, knowing that the stress will not last forever. Now we will see the criteria for mental health. Jehoda proposed 6 criteria for ideal mental health. The first one is a positive attitude towards self. This includes an objective view of self, including knowledge and acceptance of strengths and limitations. The individual feels a strong sense of personal identity and security within the environment. The second criteria is personal growth, development, and the ability for self-actualization, or the ability to grow and develop as a person. This indicator correlates with whether the individual successfully achieves the tasks associated with each level of development. The next criteria is integration, that is, being able to cope with stressful situations. Integration includes the ability to adaptively respond to the environment and the development of a philosophy of life, both of which help the individual maintain anxiety at a manageable level in response to stressful situations. Next criteria is autonomy, or being independent and self-reliant. It refers to the individual's ability to perform in an independent, self-directed manner. The individual makes choices and accepts responsibility for the outcomes. The next criteria is accurate perception of reality, or seeing the world as it is without distortions. This includes perception of the environment without distortion, as well as the capacity for empathy and the social sensitivity, a respect and a concern for the wants and needs of others. The last criteria is environmental mastery, or the ability to meet the demands of everyday life. This indicator suggests that the individual has achieved a satisfying role within the group, society, or environment. He is able to love and accept the love of others. Now we will see the characteristics of a mentally healthy person. A mentally healthy person should have an ability to make adjustments. He should have a sense of personal worth, feels worthwhile and important. He should be able to solve his problem largely by his own effort and makes his own decisions. He should have a sense of personal security and feel secure in a group, shows understanding of other people's problems and motives. A mentally healthy person should have a sense of responsibility. He should be able to give and accept love. A mentally healthy person lives in a world of reality rather than fantasy. He shows emotional maturity in his behavior and develops a capacity to tolerate frustration and disappointments in his daily life. He or she has developed a philosophy of life that gives meaning and purpose to his or her daily activities. A mentally healthy person has a variety of interests and generally lives a well-balanced life of work, rest, and recreation. Now we will see the Maslow's hierarchy for needs. According to Maslow, human needs were arranged in a hierarchy, that is, hierarchy of needs, with physiological or survival needs at the bottom, the lower ones requiring fulfillment before those at higher levels can be achieved, and the more creative and intellectually oriented self-actualization needs at the top, with self-actualization being fulfillment of one's highest potential. Maslow argued that survival needs must be satisfied before the individual can satisfy the higher needs. The higher up the hierarchy, the more difficult it is to satisfy the needs associated with that stage because of the interpersonal and environmental barriers that inevitably frustrate us. Higher needs become increasingly psychological and long-term rather than physiological and short-term as in the lower survival-related needs. Now we will see the hierarchy from bottom to top. Physiological needs are biological requirements for human survival. They include air, food, drink, shelter, clothing, warmth, sex, and sleep. Most basic needs is for physical survival, and this will be the first thing that motivates the behavior. Once that level is fulfilled, the next level up is what motivates us, and so on. The human body cannot function optimally if physiological needs are not satisfied. Maslow considered physiological needs the most important as all the other needs become secondary until these needs are met. Once an individual's physiological needs are satisfied, the need for security and safety becomes salient. That means it is most important. Next level is safety needs. People want to experience order, predictability, and control in their lives. Safety needs can be fulfilled by the family and society. They can be police, schools, business, and medical care. For example, emotional security, financial security, such as employment, social welfare, law and order, freedom from fear, social stability, property, health, and well-being, such as safety against accidents and injury. After physiological and safety needs have been fulfilled, the third level of human needs is social and involves feelings of belongingness. So the next level is love and belongingness. It refers to an emotional need for interpersonal relationships, affiliation, connectedness, and being part of a group. Examples of belongingness needs include friendship, intimacy, trust, acceptance, receiving and giving affection and love. This need is especially strong in childhood and can override the need for safety, as witnessed in children who cling to abusive parents. Esteem needs are the fourth level in Maslow's hierarchy and include self-worth, accomplishment, and respect. Maslow classified esteem needs into two categories: esteem for oneself, that is dignity, achievement, mastery, independence, and the desire for reputation or respect from others, that is status or prestige. Esteem is a typical human desire to be accepted and valued by others. People often engage in a profession or hobby to gain recognition, which gives them a sense of contribution or value. Low self-esteem or an inferiority complex may result from imbalances during this level in the hierarchy. Maslow indicated that the need for respect or reputation is most important for children and adolescents and precedes real self-esteem or dignity. Self-actualization needs are the highest level in Maslow's hierarchy and refer to the realization of person's potential, self-fulfillment, seeking personal growth, and peak experiences. This level of need refers to what a person's full potential is and the realization of that potential. Maslow described this level as the desire to accomplish everything that one can and to become everything one is capable of becoming. Individuals may perceive or focus on this need very specifically. For example, one individual may have a strong desire to become an ideal parent. In another, the desire may be expressed athletically. For others, it may be expressed in paintings, pictures, or inventions. Although Maslow did not believe that many of us could achieve true self-actualization, he did believe that all of us experience transitory moments known as peak experience of self-actualization. Such moments associated with personally significant events such as childbirth, sporting achievement, and examination success are difficult to achieve and maintain consistently. Maslow described self-actualization as being psychologically healthy, fully human, highly evolved, and fully mature. He believed that healthy or self-actualized individuals possessed the following characteristics. They are an appropriate perception of reality, the ability to accept oneself, others, and human nature, the ability to manifest spontaneity, the capacity for focusing, concentration on problem solving, a need for detachment and desire for privacy, independence, autonomy, and a resistance to enculturation, an intensity of emotional reaction, a frequency of peak experiences that validates the worth, wellness, richness, and beauty of life, and identification with humankind, the ability to achieve satisfactory interpersonal relationships. The person will have a democratic character structure and a strong sense of ethics. The person will be creative. A degree of non-conformance. Non-conformity is the tendency of a person to defy social norms and act according to their own desires for self-expression. Often, non-conformists have different attitudes or beliefs about society or the world than the rest of their community.